It's January, and a lot of people are making their New Year's resolutions based on healthy eating and how they can sustain some healthy practices around food. That's why we're here in George Mason College of Public Health Nutrition Kitchen, and I'm joined by our interim chair of the Department of Nutrition and Food Studies, Dr. Lilian De Jonge. Dr. De Jonge, Happy New Year.
Happy New Year to you.
So glad that you're here. A lot of folks really want to hear from experts. How can they make changes in their healthy eating and make it in a sustainable way?
I think the best advice and the easiest advice is to follow the USDA My Plate program. My Plate is the recommendation is to fill for each meal half your plate with fruits and or vegetables, a quarter of your plate with lean protein, and lean protein is fish or chicken or legumes, beans, and a quarter of your plate with grains and with preferably whole grains.
Great. Do you have advice on how people can make these changes? How does one go from someone who loves a lot of junk food to making these changes and adapting some of these important practices?
Baby steps. Go slow. So don't try to do it from your holiday diet to the next day, your perfectly healthy diet. So make for 1 week, you change. I increase my fruits and vegetables, even if it's not half a plate, just more fruits and vegetables than you normally eat, and you just build that. So every week you add something else to it, and eventually that becomes a habit and not a burden anymore.
Yes, those increments, I'm sure, it makes it a lot more manageable. So it seems like these days the intermittent fasting is all over the internet. Can you tell us about what it is and do you recommend it?
Well, intermittent fasting is, as the word says, you alternate fasting and feeding during the day. So you have periods where you can eat and periods you can't eat at all. The most common way of intermittent fasting is 8 hours a day of eating, so from 10 in the morning till 4 in the afternoon, and then the rest of the time you cannot eat, but again, you can still drink, and it's recommended actually to drink water and non-caloric beverages.
Mm-hmm. Mm-hmm. Is this healthy? Do you recommend it?
I would always check with your doctor or your healthcare provider first, but it has been shown to have health benefits, not just weight loss, but also because a lowering of inflammation, because you don't have high levels of glucose in your blood for a long period of time, which can delay the onset of diabetes and other chronic diseases. And it's even shown that it improves mental clarity.
And so are there any restrictions or conditions that you'd like us to understand better?
I would not recommend it for anybody who needs a lot of energy, so like athletes or children, growing children, or people with a chronic condition. Like I said before, it's always important to check with your healthcare provider first before you embark on something like this.
Registered dietitians, nutritionists, and food scientists are always having to explain complicated information about food and healthy eating. What are some of the things that you wish everyone understood about great food choices?
One thing that always bothers me, and I've seen happen a lot, is these superfoods. So people kind of focus on one specific food that has the food of the week, of the month, that is a superfood, and they just kind of have to have it every day. And I think it's so important to keep in mind that variety is very important. And that's, so a superfood is very healthy, but if you only eat that superfood every day, you're missing out on a lot of vitamins and minerals. But this also means that because of the variety, it's really not bad to every now and then have something that you like. Food should be something enjoyable and not something you should be afraid of.
Great advice, excellent advice. Dr. De Jonge, thank you so much for your time.
Thank you.